around him. So Dr. Hyman is a nationally, globally renowned specialist in the care of children with cerebral palsy and lower extremity deformity. His clinical interests in pediatric orthopedic surgery include hip diseases, dysplasia, neuromuscular disorder, limb lengthening differences, and complex care. As the clinical director of the Weinberg Center, Dr. Hyman not only looks at the medical care that he can provide patients, but he really champions also for the social aspect for children and being able to connect folks. He is the number one person in the summer that will ask us, when are we organizing a ski trip, to make sure that we have that all ready for the winter time. So Dr. Hyman is going to be a resource for us to ask questions and have conversations around advocacy and self advocacy for children with cerebral palsy. Now, the other people that I'd like to introduce are incredible folks. So I'd like to introduce Ken Bruno. Ken, if you can wave. Ken is an award-winning publicist in technology companies. He is diagnosed with mild case of cerebral palsy. During this session, Ken will offer insights and advice to children and adults and parents managing physical and mental and emotional impact of living with mild cerebral palsy. So now we have Tiffany Mason. Tiffany, if you can wave. Tiffany is an administrative assistant at St. Charles African Methodist Episcopal Zion Church. I'm sorry, Tiffany. Anybody from the church community, I apologize ahead of time. I tried really hard. Tiffany identifies as a neurodiverse individual who serves with the disability community as a self-advocate and self-proclaimed advocate to others. During the virtual session, Tiffany is seeking to emphasize the importance of self-advocacy and how as well as a strong support system is vital to members with the disability community. And last but not least, I'd like to introduce you to Matthew Kamen. Matt, if you can wave. Matt is an early career professional and background in arts management marketing who has cerebral palsy. During this session, Matt hopes to connect with the audience while reflecting on his own experience with internalized ableism. So at this point, Matt, I'd like to let you lead it away.
Sure. So, thank you, Manali, for that introduction. Um, so I thought I'd start to talk. I thought I'd start off this conversation sort of by talking about ableism and sort of how ableism is present in everyday life. Um, so first of all, just ableism, so we're all on the same page. We sort of have a shared understanding. At its very basic core is discrimination against people with disabilities. And uh, one of the and I know with myself growing up, I've had experience with internalized ableism where there's a sort of I've been sort of questioning my self-worth, and I've had moments where I where um just questioning my self-worth because I have a disability, and sort of in managing all the various aspects of like going to school, having all these therapy and medical appointments on top of that, like physical therapy, occupational therapy, speech therapy, can be very overwhelming. So, um, so um, when so what I wanted to so what I have a question for Dr. Hyman. Um, so ableism is so when treatment is discussed with patients and families, who sort of leads the conversation about about the direction that the treatment for the patient is going in? Is it usually the parents? Is it usually the patient? Or and who sort of guides that conversation? Because I know I what I would have the advice that I would have given my younger self is just to sort of it could be overwhelming sort of to plan all this out when you receive a diagnosis of CP and then just growing up. So who sort of leads that conversation in terms of care, in terms of the long-term care goals and procedures?
Sure. So it's a great question. It's a conversation that goes on over the span of years, right? Because I will meet the patient and their family at different points of their life and of their needs. Sometimes I'll meet them as infants or toddlers. Sometimes I'll meet them as an adult, and of course, anywhere in between. The first thing I do is I ask them, why are you here? It's not self-evident. They may have a very specific concern, or they may just be here to introduce themselves to the center. I need to get a sense as to what's happening. At that point, they're leading. They are giving me information. Then it comes time for my assessment, and I will examine the person, whether it's a child or an adult. We'll review the studies. And now I'm leading. I am now describing to them what I'm seeing. And then when they have that information, we now have a discussion, not so much one person leading versus the other, but we now will have a discussion as to how they perceive these findings that I've given them, how that meshes with their own preconceptions coming into the appointment. And then I'll give them my thoughts as to what I can do to try and move them along, move them forwards based upon their questions. And then it's give and take, give and take. So I like to think of it as them leading, my answering, and then after that, the discussion begins. Does that kind of make sense?
Yes, yes, absolutely.
You know, the nice thing about CP, one of the nice things, is that it's not an emergency. There's nothing hard and fast that has to be decided that day. So there's plenty of time to both gather information and impart information, but also for the family, the patient, and the doctor to get comfortable with each other, because this really is a relationship. And that is something that takes time. You know, it's different when somebody comes in with a broken leg. You gotta address the problem at hand, and there's not a whole lot of time for discussion. And whether or not you like your doctor is of less importance to how your leg is going to be managed and how it will heal. Very different in CP. So I agree with you. This notion of who's leading the discussion is a great question. And my feeling is that the parents begin and then I respond, or the patient begins and I respond.
So when we were jumping on the phone, I kind of gave you my intro, Dr. Hyman, which is that I really had not been involved in the Columbia community for, a good portion of my life. So I had Achilles heel lengthening surgery when I was a kid, then kind of just powered through it, had a little bit of physical therapy when I was 16, but just given the severity of my case, I've been able to live without assistance and things like that over time. What kind of brought me here was what I would say is like a lack of activity during pandemic times, right? Like everybody kind of slowing down, maybe not walking as much, maybe not exercising as much. I guess a question for you is like, how much of that are you seeing? Like, is it a lot? Like, are folks coming in now that kind of did have those challenges during COVID? And like, what are some of what's the advice you give those folks?
Sure. So we're seeing it runs the gamut from someone like yourself who has very mild cerebral palsy, who simply was less active, like every other typically developed person was during the pandemic, and now they want to get back into things. Maybe you have maybe slightly more challenges than someone who is typically developed, but this is a common problem, but that's one end of the spectrum. The other end of the spectrum is someone who is completely involved, who is dependent upon caregivers, therapists coming to their home. That hasn't happened. Whatever bit of function they had because of the maximum care and therapy that they were receiving has been lost. And now, finally, people are becoming more comfortable with both receiving people into their homes and going into the homes. And now they're getting services again. But my gosh, that's a long road to get back to where they were. So I'm seeing both, and that's just the therapy. Then, of course, there are the people who were scheduled for surgery, who we had talked about perhaps doing surgery in a year or two. This would have been back in 2019, 2020. And then they never had surgery. I saw two people on Monday like that. I saw one in 2019, and we had talked about surgery. Another one I had seen in January of 2020. And they're coming back now. And frankly, we had a slightly different surgical discussion than we had 3.5 years earlier. So is that kind of clear? The point is, you are not alone, but it's not irreconcilable. This is easily managed. Just getting started. And as you know, the hardest part is getting started.
Yeah, I get that. I go to PT 3 days a week. I was there this morning before running back to get on this call. Manelli, I saw you jumped off mute, so I didn't know if you had something to add.
No, I was just thinking about like this is we're in a very interesting part of just history and the fact that we were in a lockdown and a global pandemic. And the topic of this conversation is looking back at what advice would I give my younger self. So thinking about those kids who have CP or who have a physical disability that were in lockdown. Maybe this is not a question, maybe this is more of a statement. I'm just wondering how are they doing? How are they processing all of this? And then, you know, I think all of us here are 20 above right now in the panelists. I know I'm definitely 20 and above. So thinking about those kids and what they went through in lockdown, and then thinking about your childhood, kind of going back to the original question, what advice, what suggestions would you like to give those kids now that things are kind of opening back up, things are becoming a little bit more accessible to them,
I think for me, because I'm going back to what Dr. Hyman said about being more medically involved, I'm on the more medically involved side where I do need assistance from caregivers and physical therapy and things like that. So I would definitely tell my younger self or a child to go do your physical therapy. It's important to make you as independent as possible. It might not be fun while you're doing it, but go ahead and do it because it's going to help you in the long run.
One of the things that I've noticed is that physical therapy has I think there's more like adaptive sports activities to make it a little bit combination of physical therapy and also social and fun. And then I interrupted Ken because he unmuted. Go ahead, Ken.
No, it's all good. I was just going to echo what Tiffany said. I think, like use it or lose it is a real thing, right? Like sitting around and not being active at certain points in life is probably not good for kids of all ages. And I think also just like maintenance, right? Like it's just part of our job. Like it sounds silly to say it like that, but everybody has their own burden or whatever it is that they need to carry or challenge that they need to overcome, and maintenance is part of that, right? So I think that's kind of it as well.
Yeah, and I think that's a really good point. And again, going back to people who are typically developed, I view my CP kids with that same lens to a large extent, in that I tell them you need to get to the gym like any other 16-year-old, 20-year-old, 30-year-old needs to. You should be participating in athletics like anybody else, both for the physical aspect, but also for the social and emotional aspect of it. I'm curious why you go to therapy as opposed to stretching at home on your own.
So to be honest with you, it was a combination of just trying to find okay, what can I do to get started? And for me as well with my job, I was remote before the pandemic started. And so it is at times difficult for me to get away from my desk. I work in public relations. And so that often means I am just kind of sitting around waiting for something to blow up or go wrong. And so that means a lot of sitting. So it just gives me rigor, right? And it kind of adds sort of like a schedule, which helps me, because otherwise what I would do is just kind of sit around, right? But I do stretch at home, and then also kind of complement that with the physical therapy. But it also is looking like I think I am winding that down and just trying to focus on what I can do at home as well.
Yeah, sure. And again, this is something I tell the families and the kids as they're getting older, is that physical therapy is really not a sustainable lifestyle. It's good to get things jump started, and then you sort of sustain it on your own. And this sort of goes back to this notion of ableism, and trying to get away from a hard fixed diagnosis of cerebral palsy and being stuck in that box, to moving out of the box, to being somebody who might have some challenges, but out and about in the world. I'm talking clearly about the kids who are people, not just kids, who are less involved, where getting to the gym is really helpful, and often more helpful than seeing a therapist. Playing a sport, better than seeing a therapist. So these are the discussions that I will start having with my patients and their families as they're getting into their teen years.
I have a 16-year-old who is sort of on the cusp of that. He plays a lot of sports, and I actually just got a call this morning from his nurse at school saying that he's got leg pains because he's not wearing his orthotics and he's not doing his stretching. So he's gone from one end of the spectrum to the other of sort of giving up on PT and stretching and just doing these sports. So I wanted to ask this question back to you guys. How do you sustain doing PT all these years, especially during those transition years of being from a teenager to an adult? How did you or your parents get into, continue to do therapy and continue to see the doctors who you've probably seen for the most of your life? I think the transition years are a very difficult period in that, you're neither an adult, you're a child, and you're trying to make those decisions yourself. But then you still have parents or caregivers who are also trying to, help you as well. So how were those years back for you in making those decisions?
I think I can kind of answer this one. It was tough because, like I said, I'm more physically involved. I rely on a power wheelchair, and I have to have people trench me, things of that nature. But for me, it was difficult because I didn't like wearing my braces and the things I was supposed to. So I have my mom who would say, wear them because it's good for you. And I have my dad saying, well, baby, you don't have to wear it if you don't want to. So I would lean on dad said I don't have to wear it, so I'm not going to wear it. But I regret that now for some cases because it kind of hindered me more than it did help me by not wearing the things than it did to wear them. So it was hard, but sometimes I had to do things that I didn't like going to physical therapy and wearing the equipment they said to wear. But looking back now, I said, maybe if I had worn them, maybe I wouldn't had to have gone through 13 surgeries. Maybe it would have been 8 instead of 13. So, if I were to tell anybody that's an adolescent now, go ahead, even though it's uncomfortable and it's painful, it might prevent you from going through more suffering in the long run.
Tiffany, I think that's a really good point. And this is the same discussion that I'll have with my kids and their parents. The purpose of the braces is to try and maintain your range of motion, maintain your alignments while you're growing, because growth is really the enemy. Growth is what causes a lot of the problem. The physical therapy is working to overcome the tightness as a result of growth. The bracing is also trying to statically overcome the tightness as a result of growth. Once you're done growing, then the bracing and therapy are more about how you function. Also, once you stop growing, you're now older and you have more agency. You are beginning to be in greater control, making your own decisions. And like most adolescents, young adolescents, you make some bad decisions. And then you have to live with it and deal with the consequences of those decisions. And if you decide to stop the therapy, not wear the brace, you wind up getting tighter. well, then you're going to need some more therapy, or as you suggested, maybe an operation. But nothing is irreparable. I mean, it's unusual for an adult to need an operation as a result of not using their braces or going to therapy, but they certainly may suffer in terms of some discomfort and loss of function, which can be regained with more therapy, more activities, plus minus braces.
Would you suggest like braces now as an adult, being that we're kind of outgrown the growing stage? So would you suggest still providing braces and things for adults? Like I'm 30, so I'm sure I'm done growing at this point. So would you say that, you know, AFOs and things like that would be beneficial for someone like me?
Sure, Tiffany, good question. I think it is really dependent upon how you do without the braces. So for you, it's going to be about positioning, right? Where you're going to place your feet on your chair, on the floor. And if you can get your feet flat so that you're bearing weight on the bottom of your feet, that's sufficient. If your feet tend to turn in underneath themselves, or if your toes start to point down, difficult to get into shoes, then perhaps the brace is helpful. And it's really about function in that sense. And function for you is a little bit different than, say, function for Ken. Function for you is going to be getting into a shoe, having your feet flat, resting comfortably flat on the footrest or on the floor.
Thank you.
This has been so helpful. I want to check in with Matt to see if he has any additional questions or wants to share anything that came up for him in the discussion.
So I know that especially with me, especially growing up, especially as I got sort of from that child to those teenage years, I know I used to have, I believe when I was maybe about 10 or 11 years old, I started wearing a neuromuscular stimulator walk aid that would provide stimulation to my my reflexes and my muscles in my left foot, ankle and foot, so that I would prevent the foot drop. And then then after a few years, as I got older, sort of into my teenage years, um, I sort of there was a reluctance to I so I was on board early on when I first was introduced to this device to help improve my functioning and to improve my walking. But then as I got older, it would sort of become bothersome. So I guess Dr. Hyman or anyone else, to what would you suggest to someone if if they have these supports or these braces or these devices to help them, but yet, and then after they're when they're initially on board and they're all for wearing them and diligently keeping up with the maintenance of using those devices, if someone gets uh if someone gets sort of gets tired of using them, what would you suggest as an alternative? What would you how would you approach that situation in terms of so that they can sort of maintain their function and sort of ability um to just be able to best support themselves in their activities of daily living?
Sure. So I think that this is likely a common scenario for people as they're approaching adulthood. They get tired of, just as you put it, they get tired of using the devices. They get tired of going to therapy. They get tired of doing the stretching and the exercises. At that point, you need to experiment a little bit. See how do things work without them. If it's braces that or crutches that you're using to walk and you think you can get by without them, see what happens. If you find that you're not as functional, then go back to using it. But that will prove to you that they are necessary. Similarly, if it's a device simply to position, that's just using just to position your feet, and you think it's hot and it's annoying to put on and take off, try without it. And if your feet are not positioned as well as you'd like, then you realize that you do in fact need them and you go back in them. But you have this opportunity to play around a little bit, but you got to pay attention, and you do have to recognize and be willing to accept that if it doesn't work out, you have to go back. Now, sometimes you don't need the brace if you're doing sufficient stretching, sufficient exercises. And just as there are people who, run marathons and run 5-10 miles a day, there's no reason why someone with cerebral palsy can't find the time to do more exercises throughout their day.
So we're coming to the end of our section of our panelists. So this is going to be the last question for all the panelists. And particularly for Matt, Ken, and Tiffany, and whoever wants to pick up this question. So I'm curious about how was that conversation with your parents when it came to I'm having so many medical appointments. Mm-hmm. How do we include some of the things that I want to do? So how was that for you? If you feel comfortable, share what went right, what went wrong, and if you could go back, what you could do different.
I think I didn't have much of a choice until I got older. I would say from maybe 12 on. I think after my major scoliosis surgery, when I said, okay, I'm tired. Because it was one of the most painful surgeries I've ever had. So I was like, okay, I'm tired and I kind of don't want to do this anymore. I kind of have more of a choice to say, do you want to go do therapy today or do you not? Whereas when you're younger, you get therapy in school, you get therapy outside of school, and I hated therapy in school. And that's one thing I hated. And then after my scoliosis surgery, where I was pretty much homeschooled for a year and a half because I couldn't even sit in my chair, that's when I think both my parents realized, okay, let's give her more of an option to say, yes, she does therapy or no, she doesn't. So I think that's kind of hard because parents obviously want what's best for their kids, but sometimes the kids don't have a say on what they do. They just kind of do what their parents tell them, and because parents want their kids to fully function to the best of their ability, but sometimes it's more stress on the kids than not.
Sounds like your parents were very in tune to how you felt, and then they just responded.
Yeah.
I know for me, when I remember one summer when I was in high school and when I was a teen, I my parents we found out about this research study where over the course of 3 weeks I would undergo 90 hours of intensive hand therapy, and it was I would be literally whatever type of activities I could get my hands on. I would spend these 30 hours a week for 3 weeks, 30 hours a week for 3 weeks to meet with these occupational therapists, get my hands on whatever I could get on to improve the function, and and I was initially, because I was a teenager, I was like, okay, I'm a teenager. I want to spend my summer the way I would like to do. I would like to be able to have fun this summer. I want to be able to do what I want. But then we were like, oh, but wait, you could acquire then by participating in this program, I could then gain all these skills that I hadn't been able to previously. Like for example, from those 90 hours of intensive hand therapy, among multiple things that I learned how to do during that time, I was able to finally use a fork and knife to cut food, which I had never been able to previously do in my life. So it was sort of it was sort of having just knowing that even if I want, just knowing that you should always be open to listen to other perspectives rather than your own, because you don't always, I, I don't know any other words. You might know yourself really well, but you don't always know what's best for yourself. You might need to be introduced to these other types of programs or approaches in order to develop certain skills and to perform certain activities of daily living, if that makes sense.
That's great. Thank you so much, Matt. So at this time, we're going to open it up for everybody, but before we fully open it up to anybody to unmute and talk, I did want to let you know is that this is being recorded and it's going to be shared through all IAACD channels. So in case you don't want your name or like your face, please change your name on the name button on Zoom, and then, you know, turn off the camera, and or you can type in your question in the chat and we can. Okay, so iPhone is totally good with turning on the camera. So iPhone, there we go. All right, I think I asked you to unmute iPhone.
Okay, I've unmuted. Hello, Dr. Hyman. This is Mrs. Nesky.
Nice
Just saw you 2 days ago. I have a question about my son has severe cerebral palsy, and unfortunately, the pandemic happened right during his major growing period. And looking back, I can see that he missed several years of physical therapy during this really important time period. And my question is, can that be made up with intense physical therapy? Can you extend the amount of time you get physical therapy past like school age, or is it just a lost cause at this point?
Well, you can certainly make up some of the therapy that was lost, in the sense of if you get tight, some of that tightness can be worked out. I think though what we saw was changes on the X-ray, right? The
Yeah.
subluxation, the hip coming out of joint. I feel fairly confident that therapy would not have prevented that. This was something that was inexorable. It was going to happen. It was happening slowly. We had seen it before the pandemic, how the X-rays were changing, but things were not so terrible at that time. And if they had stayed at that point, he would have been fine. But seeing as how the X-ray has changed, how his examination has changed, and you've noticed that tightness of the left hip has gotten worse. I don't think that therapy would have changed it. I think, as you also mentioned, it was growth, his growth. And this is pretty well recognized at this point in people who have that level of cerebral palsy, whose hips have demonstrated an issue when they're younger, that it is going to happen. But the good news is he's not having any pain. And I think that if we address it prior to his developing pain, he will continue to be pain-free, and hips will be protected, and it won't be an issue. He will get lots of therapy once we're done with the surgery.
Right. And I just have a quick follow-up question. The kids can go to school to the age of 21, and of course they receive therapy in school. And I, as a parent, am unsure, like, what happens after that. Does anybody have any idea of how therapy works after the age of 21? Is it still available?
That's a good question for the panelists.
Yeah.
I think I can kind of answer that a little. It depends on where you are, and if you're under OPWDD or under something else. Because right now I get physical therapy from Article 16, and that's under OPWDD. I will get it until I guess they determine that I don't need it any longer. I have gotten it for years, from I guess 18 until now, and I'm 36. So unless my physical therapist decides to discharge me or OPWDD decides that I no longer need it, I'm going to continue to get it as long as I have a prescription for it.
Okay.
So
Okay, that is an excellent answer. Thank you so much for your help with that. I appreciate it.
No problem.
Yeah, I would just add that that's a great answer in New York State. And then unfortunately, this is very regional and it varies state to state. I would recommend anyone who's from a different state to speak with a social worker, a case management person, somebody who has better information about this. I don't pretend to know any of these things. I have many patients from New York, New Jersey, Pennsylvania, Connecticut, just the local area. And each state and each situation is very different, unfortunately.
So this is very general advice that I do sometimes, like when there is a patient like from Pennsylvania and I'm not sure because I'm really better well versed in like New York and New Jersey, is I'll go to their counties or their cities government office, and every government office typically has a social worker that kind of can direct you to where you would go to for this specific need, whether it be for like older person services or disability services, different things like that. And they'll be able to direct you to like the office in your local area. So I hope that helps a little bit. So we have some questions in the chat. I was thinking which one of the panelist members wants to take on the chat? Ken, putting you on the spot, or Tiffany, putting you on the spot?
Do you answer both? Answer one at a time? What are we thinking?
There's one first around tightness. Tiffany, do you want to take that one, and then Ken takes the next one?
They want to know, does tightness and pain as a teenager continue into adulthood, if I'm understanding the question correctly?
Yes. Let me see. Let me read it on. Does tightness and pain I'm experiencing as a teenager due to growth subside as you go into adulthood? Why don't we share from a personal experience and then tap into Dr. Hyman?
I think for me, I can only speak for me, but your tightness and pain changes based on your level of stress, the amount of PT you're getting, and your lack of or amount of activity you're doing. And also the weather. The weather plays a big role in tightness, muscle tone, things of that nature. And that all contributes to pain or no pain. So I know when it's colder, I'm in a lot more discomfort than it is when it's warmer. Anyone on here that knows me, I tell them all the time, I hate cold because I'm always cold and it doesn't agree with my muscles. And when I'm stressed out, my muscles tend to spasm more. And when I'm sick, I have more spasms. So it all just depends on your climate, your level of stress, and your health too. Because when you're sick, your muscles tend to act up a lot more also.
We pass it off to you, Dr. Hyman?
Yeah, sure. I'll tell you what, I am going to take my prerogative and I'm going to pass this on to Dr. Azizi because Dr. Azizi has a lot of experience.
Is she here?
She is, although he may not be.
Hi.
You are good. Now we see you. Magnificent.
Thank you. I was just on mute. Thank you so much, Dr. Hyman and Minelli. I'm so
Let me
glad.
just say, Dr. Azizi is a physiatrist, a pediatric physiatrist, rehabilitation doctor who's been with us for many years. She is outstanding. But not only is she a pediatric, well, she is a pediatric physiatrist, but like myself, takes care of a number of adults with neuromuscular conditions. So has a lot of experience in how kids transition to adulthood, how their bodies change, how their symptoms change, how their function changes. So I think she'd be a terrific person to respond to this question.
Thank you, Dr. Hyman and Minelli and the co-host, all of you, and Jacqueline. I'm so glad that you had this webinar today. So as Dr. Rahman said, yes, I'm a pediatric rehab person, but maybe 40% of those I see, I provide care also to adults. And because the question is related to tightness and muscle spasms, it's not comfortable to live with pain. Probably it's not very good and pleasant, and not a good life to live like that. So we have different treatment options for hypertonia. And I say hypertonia because it could be spasticity, it could be dystonia, which is what Mrs. Niski's son has. He has a lot of dystonia in addition to spasticity, and it could be some other forms. So there are medications for hypertonia, of course, which can help relieve the spasms, the tightness, the pain. The medications could be oral, could be like a patch, could be a pump, could be injections. So definitely during childhood, especially when they are growing and the muscles, the bones grow, but the muscles may not grow as much. And then that's where they feel, as Dr. Hammer said, growth is the enemy. So it's good to be tall, of course, but to some extent. So when they grow, then they may notice pain, tightness, and then there's a change in their walking, because then they start tiptoeing, or the gait, and the gait will change. So this is the time that we start providing them with different treatment options. It could be something as simple as stretching, physical therapy, occupational therapy. Then after that, and we go stepwise, we don't provide the most intense treatment right away. And then after that will be bracing. So stretching first, bracing, if needed, medications, then we recommend surgery. And trust is very important in a provider and a patient relationship. And to know that when something is recommended for the children and the grown-ups, anyone with cerebral palsy or any other condition, it's the best treatment option for them. And and then for medication, of course, they are different. And for injections, what we use is botulinum toxin. And that's it. I hope I answered, but if you need more information, please let me know.
Jackson, I think that the sort of the quick answer to your question is, does the tightness and pain that you're experiencing as a teenager due to growth subside? I would say it changes. And that's one of the challenges for people with cerebral palsy, is that although we as the doctor may think that everything looks okay, you still can have pain. And although you're done growing, you can still have pain. And as Dr. Azizi said, that she does have a couple of tricks in her bag for managing these types of pain that people with CP get themselves into. But often just a good, healthy, active lifestyle is sufficient.
Thank you. So there's a great question here for the panelists, and I hope I asked this question correctly. Is thinking back, do the panel members think that they would appreciate advice better as teenagers if it came from an adult with a similar condition? So I'll tag you in, Ken.
So sorry, Ken, before you answer, I just want to say
tell
you who this person asking the question is. This is Dr. Arnab Seal. And so he is a developmental pediatrician out of the UK, and is a executive committee member of the IAACD, and has tremendous experience in caring for people with cerebral palsy. And this is a very insightful question, because this is what we want to know as people who take care of children. Do you like what we're telling you?
Yes, it's an important one also, because if, as we suspect, the answer is possibly, then maybe there's a role for the IACD to develop some, maybe videos or other things for people with lived experience, which can potentially be useful for our community at large.
Yeah, I think there's the answer that I want to believe now, and then there's probably the answer that is the reality of what you are when you're growing up as a teenager, right? So I think, I guess when you boil it down, mentorship is important, right? Across the board, and being able to provide someone with advice and insight into what is going on based on lived experience is super important. So like for me personally, would I have benefited from that? Yes. Would I have listened to everything that they said all the time? Probably not. However, that does not mean that, that presence would be, a detriment or, something like that. I think there are certainly situations where I really wish I did, right? And I know there's other questions in the chat, so I don't want to take up too much time, but like the transition from like, teenage years to adult years and just, or even being, 13, 14, 15, like growing up with this and kind of, and in my position too, like kind of feeling like you're caught between two worlds sometimes. I definitely wish I had someone to talk to. And I think that's why I'm here in the first place, like, is because as I'm getting older, I needed to seek out those resources. And what I'm finding is that regardless of the severity of the case or however you want to put it, like there's a lot of stuff that goes on mentally and physically that we all share, right? So yeah, I think so. I think it would be super helpful.
I want to add one quick thing that Ken's not adding. So Ken, I do family therapy, and because there's children with cerebral palsy there, and I don't have cerebral palsy, and I think it's really important to hear it from somebody with cerebral palsy, Ken jumps in the family therapy sessions, and we have sort of like a group discussion, and he, with any similarities that he has to experience to the child, he's able to answer it to the parent and also the child and connect. So Ken didn't share that, but I'll share that about you, Ken.
Cool.
So I wanted to jump over to Heather before we run out of time. Go ahead and unmute, Heather. Feel free to ask your question.
Well, I did put it into the chat because I wasn't sure if it was appropriate to discuss anything beyond the transition years at this point.
Well, I got a message that that we think it's important to share your perspective as well.
Okay, I'm new to this forum and to this community, so thank you for letting me have the stage for a minute. I live in Canada, and our medical system is a little bit different here than there. There is no research being done in this country. And most of my recent, say the last, well, since 2016, I've been involved with CPRN. Don't know if you guys are familiar with that, those people there, but there is my CP there, which is a group where everybody, once you get past all the surveys for the research and stuff, you get to the discussions, and that's where you can have peer-to-peer support. I'm 55 years old, living with spastic diplegic cerebral palsy on the other end of the spectrum of aging. So while I fully agree that the transition years are important, equally as important are the challenges. That's right. That's the right address. Equally as important are the challenges as you get older. I was considered mild growing up, mild CP, GMFS level 1. Now at 55, I'm level 3, and have lost a lot of function over the years for various different reasons. Some orthopedic surgery that failed when I was a teenager because I didn't get any say in that surgery or those surgeries at the time. It started when I was 13, so I went till I was 18. And unfortunately, it's had a detrimental effect to my ability to ambulate. Also, in Canada, once you turn 18, everything stops. So if you need to have, sorry, my voice is not good. If you need to have physio or anything like that, you need to be able to pay for it. The understanding that Canada's healthcare is free is just a fairy tale. So it is not. And we have no doctors here that specialize in CP in any of the specialty areas. The most I've had over my lifespan is I had about 17 years with a very excellent rehab physiatrist who did Botox for me. And it did work for 17 years, but that muscle wasting became an issue. And we agreed to cease and desist at that point. So I'm dealing with chronic pain, chronic fatigue, and I've been medically retired for 11 years, simply due to pain and my employer's lack of ability to address accommodations so that I could remain at work. They couldn't do that. Neither were they willing to find me another job. So I've had to kind of reinvent myself a number of times. But currently I'm a writer and an advocate for adults with CP here in Canada. So I don't know if I really have a question beyond that. I just wanted to tell my story. If I could tell my younger self anything, it would have been to say no to those surgeries if I could have. But it was a different era back then. You weren't really allowed to speak to the doctors like you can now, especially in your particular situations. You're so fortunate. And I would get myself to a gym much earlier, I think. Up until I was about 30, I didn't even think gyms were accessible for us. So, like regular gyms, community gyms, that kind of thing. So I did go to one for about 3 years, and there was great improvement. And then I lost my personal trainers. And then it was all downhill from there. So that's just a little bit of my story, and I hope it's not a downer because, like I said, there's extenuating circumstances for the things that I'm dealing with. So, but yeah, I would encourage all of you younger people to keep doing exactly what these doctors are telling you to do, because as you get older, it gets harder. It gets a lot harder. So just keep going, and I will meet my mic.
Heather, thank you so much for, sharing your story with us, sharing your story with the community, and allowing people to hear your experience and be able to know a little bit more about how to make their decisions. I think your experience has probably helped a lot of people today make different choices. And please know you can reach out. You can reach out. We have our Weinberg Center has events, free events, where we have the doctors speak and we have them connect with the community. I think that that's what we really like to do a lot of, sort of getting rid of that wall and being able to be more of a community, everyone together.
Manila, can I chime in for a second?
Yeah, please do.
Piggyback off of the last thing Heather said, to continue to do what the doctors are telling you to do. I think also it's important to also have a circle of support that you can kind of get feedback from, even if they're not in the situation. They can kind of help you weigh out the pros and cons of doing or not doing what the doctor is saying. I have a large circle of support, a lot of whom are on here today. Thank you guys for checking this out. I appreciate your support. But, I'm able to bounce off ideas and thoughts off of my circle of support because, even though they're not in my shoes, they're willing to listen and say, well, Tiff, this may be a good idea, or this may not work, or this might work if you try it this way. So having a circle of support and things of that nature is also helpful to the patient and also the parent, because the parent, because they have a disabled child, it's not something they've been through before, so they might need a separate circle of support themselves to help them walk through things and ideas that they're also experiencing, not from the adolescent or the child's perspective. So I think that's also important besides having a team of doctors, a circle of support is key.
So well said. Love it. So we have about 5 minutes left, a little less than 5 minutes. I want to check in with the panelists. Is there any little last things that you want to share with the audience, with the world, before we all sign off?
I think what the last year of being involved in our group, Manelli, and the conversations that we've had, what it's taught me is that like the cerebral palsy is so darn unique, might be the way that I would put it. There are so many different people with so many different degrees of things. And I think the number one thing that I'm finding is that, like, for me personally, like, yes, I am not an NBA athlete, but I am good at stuff, right? Like, and I feel like that's kind of what I have learned from everybody here is, everybody's good at something. Everybody has something unique to bring to the table. I know Matt is passionate about Broadway and theater and have enjoyed the conversations that we've had on that front. Tiffany, I know we are getting to know each other a little bit better, but it seems like we have a lot in common in terms of like PR and marketing and what's going on there, right? And so I think the number one thing that I've learned is everyone has very unique stories to tell, but also even if those stories don't always involve, I guess what I'm trying to say is that everybody's good at something and everybody's got something to share. I think that's kind of the deal at the end of the day.
Ken, I think that's a really good point. You know what? I see Arnab has something to say.
I was just reflecting on Heather sharing her story. And, it's very important regarding your reflection that you would have gone to the gym earlier and the physical aspects of therapy and treatment. But the other thing, which was also there in some of the discussions previously, was the different systems and healthcare systems which are a barrier to accessing what would keep you healthy. And that's across the world. And even within countries, we were discussing that one state is different from the other. And these are areas where your stories as an adult who has a condition and where you've actually seen a difference, where as an organization, whether it's the International Alliance or any of us in organizations coming together with people with lived experience, where we can raise our voices to make an argument to policymakers that things must change, that this is not an option. This is something essential for care.
That's a really good point. Of course, you're raising the issue of advocacy that another person raised in the chat. And this is something that certainly individuals can do. People with CP, family members of people with CP, people who take care of people with CP. And also, we are trying to do this at the institutional level. It's a challenge in that it's worldwide, Arnab, as you say. We just have to keep pushing, keep being outspoken, make sure that people recognize people with cerebral palsy exist. And not only do they exist, but they exist in numbers. It's not just exist in numbers that we're a force to be reckoned, but that it's enough people that should gain our attention to provide support. It is not an insignificant amount of people. It doesn't matter. It really does matter. But unfortunately, it is going to take time, and it is. But I'm confident that we will continue to make positive changes, particularly specifically because of the people involved. There is great passion and ability.
Thank you, Dr. Hyman. So our hour is done. Thank you, everyone. So join our colleagues in Chicago. I'm trying to copy the Zoom link, but it's also on the IACD website to put in the chat. So the colleagues in Chicago are now talking about building blocks of resiliency for adults with cerebral palsy. Thank you to the panelists. Thank you, Dr. Hyman, Jacqueline, Matt, Ken, Tiffany, and Heather. Our panelists we didn't know we needed.
Yeah. This outstanding session, guys. Thank you so much. You really added a lot to it. I've learned a lot. I really enjoyed it. I hope it was worthwhile. And as you say, on to the next.
All right.
The marathon.
Bye, everyone. Take care.